Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about the potential impact of a knee replacement on the hip or other joints in your body that are experiencing arthritis. Hey everyone, Dr. Luke Peterson here, physical therapist. So what we're talking about today is when you have a knee replacement surgery, a lot of people who get knee replacement surgeries done have arthritis and joint pain in other joints of their body. So this may mean the opposite knee, this may mean the hips, either on the same side or the opposite hip. It may even mean in the foot and ankle as well. And of course, you can have arthritis in your shoulders and things like that too, but that might not be as impacted by having a knee replacement surgery. So let's focus on the lower extremity, the legs. So you have a knee replacement surgery and you also have arthritis and pain in either your hips or your opposite knee or maybe even in your feet and ankles. And the question is this going to impact my other joints, these other joints that have arthritis? Is it going to make it worse? Is it going to cause damage and cause problems with my hips or my knee, my other knee? And the answer to that is no. So when you have a knee replacement surgery, obviously you are going to be moving differently. You're going to be walking differently. You're going to be functioning and moving in different ways as your body heals and recovers, as you decrease strength or decrease pain, as you improve your strength, as you improve your range of motion in that knee. You're going to start to tolerate things more and more. You're going to start to move a little bit more efficiently, a little bit more normally, so to speak. And so initially in that rehab process, you might be putting stresses through other parts of your body that aren't normal, that you aren't used to. We talk about this with people who get low back pain or get that hip pain or hamstring pain, any type of pain after a knee replacement. They get pain in other parts of their legs and body. Well, the thing is, you're putting different stresses through your body that your body's not used to and hasn't experienced before because you're moving differently as you rehab and recover. And that means that you probably may have, in the short term, increased hip pain. You might have increased pain on that opposite knee because you're putting more stress and more force through those joints, or different stresses through those joints. Now, as your body rehabs and recovers, and like I said, as you improve that strength around the knee that you had surgery on, as you improve that range of motion and mobility, as you improve the tolerance to walking and doing activities, you're going to start to move in a more normal pattern, and you're actually going to be more comfortable in the long term over time as you recover. This is a process. This is weeks. This is months. You're actually going to be using that leg ideally more efficiently. You're going to be dissipating forces more efficiently through that knee that you had surgery. And it's actually going to hopefully, in most instances, decrease the stresses, decrease the forces going through those other joints, going through your hip joints, going through that opposite knee, going through your feet and ankles, because you're just going to be moving more efficiently, utilizing all joints of your body. So in the long term, in most circumstances, it's actually going to help improve those symptoms in those other joints. Not in the short term necessarily. As you're recovering, you're moving a little differently. You have the pain still. You might have range of motion limitations still. You might have weakness still. But in the long-term picture, ideally it's going to help improve what you're experiencing in those other joints, decrease pain, decrease discomfort, improve tolerance to activities as your body is better, moving better, dissipating forces better. So the answer is, in the short term, maybe some discomfort, but long-term, big picture, having a knee replacement is actually going to be beneficial for a lot of people in terms of experiencing arthritis and pain in other joints of the hips or the opposite knee. Thank you very much for watching, everyone. As always, please be sure to subscribe, hit that button in the corner, post videos all the time, questions, everything related to knee replacement surgery, deciding if surgery is right, preparation, recovery, the surgery itself, frequently asked questions. Thank you very much for watching, everyone, and take care.